Welcome. There are a number of ways you can lower your chances of having a heart attack or stroke. So here are the 10 important ways you can lower your risk of heart disease and stroke. 10. Stay informed. Science changes constantly. In medicine, new techniques and new insights are developing constantly. Keep yourself current with the latest advancements by regularly consulting accredited publications, journals and websites. 9. Reduce stress. Stress contributes to cardiovascular disease and, if severe enough, can cause a heart attack or sudden death. There are many ways to reduce stress, such as regular exercise, adequate sleep, laughing, volunteering, gardening, having a pet, playing an instrument, mentoring others and cultivating friends. Find what relieves your stress and commit to doing this activity at least once a day if possible. 8. Choose your medications wisely. Although some vitamins have been shown to possibly help some health conditions, to date none have been shown to decrease the risk of cardiovascular disease, with some rare exceptions, such as fish oils and niacin, vitamin B. It is also important to note that high doses of some vitamins may interfere or counteract the beneficial effects of some prescription drugs. 7. Make exercise a daily habit. Lack of exercise is greatly contributing to the prevalence of obesity in America but is something that can be easily turned around. Exercise does more than burn calories, it also activates genes that are beneficial to your health in other ways. Plus, exercise is one of the best treatments for depression and anxiety. However, exercise alone cannot control or reduce a person's weight, they must also modify their diet. 6. Limit your calories. The obesity rate in Americans is alarming, contributing to a widely considered epidemic of diabetes, which is a cardiovascular disease. If you have diabetes, your risk is the same as someone who has already had a heart attack. Eating less and exercising more are the two most effective, tried and true solutions. 5. Monitor your cholesterol, blood lipids. Abnormal or high blood lipids, fats, are a major contributor to cardiovascular disease. Your blood lipids include the LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. The lower your LDL and the higher your HDL, the better your prognosis. The amount of cholesterol in your blood is determined mainly by 3 factors: the amount produced by the liver, the amount absorbed from the intestinal tract, and your age. Your cholesterol increases with age. If you are at risk, medication and/or a change in diet are almost always necessary to lower the LDL or to raise your HDL. 4. Maintain a healthy blood pressure. High blood pressure, hypertension, is commonly known as the silent killer because it typically has no symptoms in most individuals. High blood pressure does damage to your heart by causing wear and tear of the delicate inner lining of your blood vessels. The higher your blood pressure, BP, the greater your risk of heart disease. Heredity and increasing age put you at greater risk. If you can, get an in-home blood pressure measuring device, which will more accurately determine your true blood pressure at rest than having it taken in a physician's office. 3. Don't smoke or expose yourself to secondhand smoke. The evidence is overwhelming that cigarette smoking and secondhand exposure to smoke increases the risks of heart disease, lung disease, peripheral vascular disease and stroke. If you smoke, stop. If you don't smoke, don't start. 2. Know your risks. The biggest risk factor for cardiovascular disease is age. The older you are, the greater your risk. The second biggest risk factor is your genetic makeup. If your parents, grandparents or other close relatives experienced or died of heart disease, diabetes or stroke, your risk is much greater. 1. Take responsibility for your health. At Westchester Health, we tell all our patients that the best prevention against heart disease and stroke is to understand the risks, warning signs and treatment options. The first step in preventing heart disease is to take responsibility for your health. It is health that is real wealth and not pieces of gold and silver. Thank you for watching. Please like, comment, subscribe and click the bell icon for more upcoming video.